Ben and Amanda, on Tuesday, the governor said the focus was to speed up testing capacity, and since then, testing has increased to about 40 to 60 tests per day. Today's focus was to come up with ways to slow the spread of this virus through the 3 executive orders implemented by the governor.
70% of our population is expected to have this illness.
State epidemiologist Dr. Matthew Carter speculates there will be a continued spread to Litchfield and New Haven counties, a spread they may very well go into the summer or fall season. Comparing it to the norovirus, Dr. Carter says everyone's best bet in not getting coronavirus is by cleaning and disinfecting. To reinforce prevention, the governor has mandated there will be no more group gatherings with more than 250 people.
Those groups, especially when they're standing close by, Susan, step away a little bit. We should be a few feet separated from each other.
Public places like the DMV, notorious for large groups of people in one room, will be a different scene. Lamont has extended renewals to 90 days just to avoid long lines.
And we're going to be rolling out additional services like that provided by the state, so you don't feel the need to go in and congregate in areas where there may be a big group.
The biggest headline, schools. The rule that schools must have 180 learning days in a year has been waived, allowing superintendents to figure out what steps they want to take.
State Department of Education does not close schools. So that's a very important thing to point out. There are currently 19 districts that have either closed or are scheduled to close in the next day or two.
People have also expressed concerns about employers and what should be done if a worker were to become infected. Chief Operating Officer Josh Jabal says an unemployment compensation initiative is being worked on. He stressed it will be up to businesses to decide who can or cannot come to the office.
We're working very hard with support from our federal delegation to line up some supports for people, for small businesses, to help them get through this. This is not going to be here forever. This is going to come and go.
Jabal also spoke to Fox 61 one-on-one on current status of the alternate collection sites. The first site, which will look like a tent, has been set up outside of Greenwich Hospital. Patients will drive up, fill out paperwork, and have their throat swabbed by a physician in a full suit of protective gear.
These people are highly contagious, and they don't need to go to the emergency room. 80% or 85% of the people who get this are going to just recover at home. So we need to keep them away from the emergency room so that our resources and our doctors and nurses in there can focus on the patients who are really critically ill.
And another important reminder from Chief Operating Officer Josh Jabal. He says if you're not feeling well, visit your primary care doctor first. They will then make the decision of whether you need to visit an emergency room or not. Carmen Chow, Fox 61 News.